Right now, I want to welcome to the program from Doctors for Responsible Gun Ownership. Dr. Robert Young is with us. Dr. Young, how are you doing, sir?
Good afternoon, Cam. Very well, thanks.
I appreciate you coming on the program. So you've taken a look at the recent issue of the Canadian Medical Association Journal. There's an article in there from the Toronto pediatric team, Natasha Saunders, Hannah Lee, Allison McPherson, Jun Goon, and Astrid Gutman. And you say there's some, quote, astonishing misuse of language masquerading as medical research here.
Exactly. In fact, that's the only way they probably could have written something that they could publish that would continue to support the medical homophobics complex about gun control. And they certainly tried. They tried very, very hard. A for effort here, Cam.
Okay, so what were they looking at? What was their article all about, Dr. Young?
Well, where is that title? The risk of firearms injuries among children and youth of immigrant families. Great title, because firearms, children, immigrants, boy, we are all interested in those things nowadays. Their thesis is essentially that children are injured by guns in Canada way too often. And that's beyond the what we think of as, of course, any injury is one too many. But what's fascinating about this is what these terms actually mean. And for anyone who looks up this article on drgo.us, they'll see that all these terms in my title are in quotes: children injured, guns in Canada. For a statistical reason, to them, children and youth are anyone up to age 24.
Up to 24.
Immigrants, hey, that's their definition, not mine, Cam.
It wasn't mine. I was married. I was a stepdad to two kids when I was 24. So okay.
Well, your fiance then should have been ashamed of herself. Obviously.
I'm having dinner with her tonight. I'll tell her about that.
All right. So immigrants are anyone who came to Canada themselves or were born to a mother who had immigrated. Now, I don't know how far back that goes, but I suppose if someone immigrated to Canada as a child in 1960 and then in the 1990s gave birth to a child who's not yet 25 years old, that person would be counted as an immigrant.
Mm-hmm.
Curious. Of course, it doesn't include undocumented or temporary residents. For what reason, I can't explain. Now, firearms, they include what you and I consider firearms. They also include air guns, BB guns, paintball guns, airsoft guns, resulting in injuries which include deaths. We don't usually treat deaths as injuries in most research, but they also include a bruise somebody might have gotten from a BB gun once.
Okay, everything from a fatality to a bruise.
Absolutely, from anything from a real firearm to a BB.
Okay, so as expansive a definition as you could possibly come up with. Okay.
Absolutely. I mean, this really gives them some big numbers to work with, and those of us in research like doing big numbers because they're impressive. Accidental injuries include police shootings. Again, I really can't explain that one because I think most police shootings are intentional, at least. And Canadians, well, they only their sample only included people who live in Ontario. So I really would have to title this paper far differently if I were writing it.
Yeah, well, you would, but I guess they can get away with it. So what did they find? What were their findings, Dr. Young?
Well, the findings were, of course, that there were far too many of these things.
Uh-huh.
But, yeah, and of course, there are fewer of these things going on in Canada anyway than in our country. So fewer is relative, and it's in the eye of the beholder, and it's too much for them no matter what. I'd like to put this all together in a sentence, but it's awfully complicated. But can I give that a stab, Cam?
Yeah, absolutely. Go for it.
All right. This is what their research really means. Ontarians up to 24 years old, immigrants to Canada, specifically from Central America and Africa, including first-generation Ontarians born to mothers from there, experience more injuries or deaths of all kinds from projectiles fired from real and toy guns, including getting themselves shot by police, than other immigrants or first-generation Canadians from anywhere else, or Native Ontarians of the same ages. That's what they actually found out. Now, I don't know what import that has, except perhaps culturally. But then that starts to undercut the whole point of blaming the tools for all this.
Well, it
start dividing it out that way.
It does, but look, this advances the narrative, right? This advances a narrative of firearms are bad. Youth shouldn't be around firearms. People are going to get the headlines. People, I imagine most doctors are only going to get the headlines. They're not going to read this study. They're not going to go through the verbal gymnastics or the linguistic gymnastics that you went through to actually decipher and figure out what the study says. They're just going to look for the top line, which I think it's valuable that you're coming out and talking about this. Our friend Brian Lilly has a piece of the Toronto Sun talking about this, and I, it's interesting. Brian says, for this study, the authors broke down age by splitting the subjects into two categories: under the age of 15 and 15 to 24. Most of the injuries, he said, were in the 15 to 24 category. When I asked the people behind this study for a better age breakdown, specifically how many were adults over the age of 18, they couldn't tell me. But he said, given that 7 out of the 10 years in that cohort are 18 to 24-year-olds, I'm willing to bet, he says, most of the injured in this study of children and youth were actually adults. Dr. Natasha Saunders was asked on radio, okay, so could these injuries that include 22-year-olds running around a paintball field at a bachelor party, the youth injured by firearms? And she said, after a pause, yeah, I mean, that could be the case. I am failing to see, as you say, Dr. Young, the legitimate research value in this story, but I do see the propaganda value for the anti-gun activists with a paper like this.
Well, there's an interesting coincidence that I found associated with this. On the same day as this article's publication, the Canadian Pediatric Association published its newest recommendations about how doctors should treat gun ownerships by families. And as always, they include the advice that firearms should not be there anywhere for children and adolescents live or play.
Same day this research paper comes out.
Yeah, maybe not, right?
Just one of those serendipitous moments, I'm sure.
Absolutely.
Yeah. Listen.
I also was intrigued by the editor of the journal's response. I think it may have been to Brian, I forget now, but she was asked how this possibly got through peer review to be published with the implications that it has. And she wouldn't say anything about peer review, but she said that, of course, we were going to publish it because the authors come from world-class research institutions. Now, we've heard of ad hominem arguments against people, where we say, well, this person did something terrible years ago, therefore we can't pay any attention to his research. This is a new tactic called ad hominem praise. This research is valuable because it comes from someone in a world-class institution. It doesn't have to be evaluated on its own for the sake of the validity the research actually conveys.
That's modern science for you, I guess, Dr. Young. Listen, I
think so.
I do appreciate you covering this story. I appreciate you joining us on the program, as always, and I hope we get a chance to talk again very soon.
We will. A couple of us from DRGO will be at the NRA meeting camp, so with our press passes, and we will come say hi.
That is excellent. I look forward to seeing you in Atlanta in a couple of weeks then, sir.
All right. Take care.
All right. You too, sir. Dr. Robert Young joins us from Doctors for Responsible Gun Ownership.